Hello, everyone, and welcome to the second lesson in the upper intermediate course. And we're going to talk about something that's important for all of our lives, each of our lives. We're going to look at present in the grammar. We're going to look at present perfect simple and continuous and go through the details of their differences. They oftentimes parallel with the present simple and the present continuous. Then the vocabulary, which we're going to look at first, deals with illnesses and injuries. It's a fact of life that all of us get hurt or injured or both. And then we'll do some pronunciation, or at least you'll practice that with the English file audio recordings. So let's talk about illnesses and injuries. Have you ever stayed in a hospital for overnight or for a long period of time? I hope not. I've had 2 or 3 stints in the hospital. Stints are like episodes or times. I'll write that word down because it's quite interesting. Stints. Normally you have job stints. So I've had a few job stints here or there. They're normally short periods of time. But I was in the hospital a few times. Nothing serious, thankfully, but I was injured and needed medical attention. Medical attention means you needed a doctor. All right. What we're going to do, though, is we are going to look at some of these, and I actually will probably discuss it during the live, but it's going to be really interesting to talk about with partners. Now, as I mentioned, some of you are in the medical profession, and so it's going to be a bit easier for you. But I'd like you to go through these. Number 1, what's the first thing you should put on a burn? Butter, cool running water, or an ice pack? Now, the answers are going to be found below. So if you want to find out the answers, you can. If you want to have a discussion, but I go through that and see how well you do. There's choking here in number 4. You can see, and bleeding in 2 different places here. Not very pleasant. Some of us are afraid of blood. I have a friend of mine. He's so averse. Oh my gosh, this is a big word. Let me write it down. He's so averse to blood that he can't look at ketchup. It's too traumatic. I think that's really funny. What about you? Do you have any of these phobias or fears or something? All right. I hope not, but many of us do. In general, I think women can endure more pain than men. Obviously, childbirth is one big example, but there are others, I think. What do you think? Is that true or not? Let's get your opinion on that. All right, let's go to the this is the vocabulary bank. Now, the vocabulary bank is actually done for you with the listening file. So what you're going to do, or the audio file, you're going to look at the term and then match it with the picture. So here, this is a rash. It's a breaking out of the skin, oftentimes redness, and oftentimes it itches. If any of you have had the chicken pox, do you know what the chicken pox is? All these red things all over your body, and they itch. Generally, we have it when we're young, one time in our life, and then we're fine. But it does infect most of us. Have you ever had the chicken pox? Hopefully it wasn't very serious. It didn't require medical attention, just a lot of love and care from your mother or your parents. All right, now what I've done, since the audio files do most of this for you, I've decided just to highlight things that you might not know about because they're not going to explain some terms. So let's go ahead and look at them. Aches. Now we have an expression, aches and pains. Aches and pains. An ache is when you feel, oh, ow, it's aching. It hurts to move. That means it's aching. It's painful. Consciousness, if you lose consciousness, you don't remember anything. So I'm conscious now. If I lose consciousness now, I would fall over onto the ground. I wouldn't die, but I would be unconscious. That's to lose conscious. unconscious, but don't confuse it with subconscious. Subconscious are things we do without thinking about it. Unconscious is when you're down on the ground because there wasn't enough oxygen to go to your brain, or there was a big shock and you fainted. We say fainted. Sometimes you're dizzy. If you're dizzy, your head spins, there's not enough oxygen and you fall. I was recently at a concert in Rome, actually, and it was pretty hot in the room. It was a beautiful big cathedral, a Rome cathedral. I'll tell you, it's Great Saint Mary's Church in Rome. If you've ever been there, it's Saint Maria Maggiore in Italian. Beautiful setting, but very, very hot. And there was a choir and an orchestra and some singers. It was a really beautiful private concert, actually. And I noticed in the back, one lady had to step down and go sit down. She was getting dizzy and almost lost consciousness. She had to sit down. They came to her. She drank water, and then later she was fine. All right, spinning around. When you spin around, you turn around. Now, if you spin around too quickly, what happens? You get dizzy. Have you ever done that as a child? You spin around, you're playing games, and then you walk like this because you're imbalanced for a while. Kids like to do that. All right, let's move to a few others. Spilt. Now, I underline this because spilt is British, and spilled, S-P-I-L-L-E-D. Let me write that down for some of you who'd like to see this. Spilled is here. They're both the same, but in the US we say spilled, and in the UK they say spilt. Now, I've also underlined swollen because it means to swell, swole, swollen. It has swollen. So swollen means it gets bigger. So if you hit your elbow really hard, and maybe it will swell, it will get bigger. What swells? Your ankles, your knees, your elbows, your fingers, your joints. Any joint can swell. These are joints. Now, if somebody metaphorically, you can say his head is swollen. Swells, his head swells, it gets bigger. Metaphorically, it means he thinks he's good. He thinks he's really talented because he's getting a lot of praise. So your head swells. It means you feel, oh, I'm so good. Wasp. Do we know what a wasp is? A wasp is that it's stronger than a bee, I think, and it stings you and it itches. A wasp. And a rash is what we saw earlier up here. This is a rash in number 1. We see it on the left in the picture. A wasp also in the US has a different meaning. White Anglo-Saxon Protestant. White Anglo-Saxon Protestant. That is known as a wasp. It's a section of society. Oftentimes, early Americans were considered wasp. They were mainly white, Anglo-Saxon from England, and they were Protestant, not Catholic or Muslim or Jewish. All right. Now, common treatments. I've actually done a bit more than what they've done here. So let's just take a look. We've got common treatments. A minor cut, headaches. Oh, headaches are terrible, especially if they're migraine headaches. Has anyone ever, I hope not, but if you've had a migraine headache, not sure they go through this word, so let me just write it down. A migraine. I've got a migraine. It's so strong, it's so intense that it debilitates you. Debilitates you. It means you can't do anything. You have to lie down with no lights and just try to wait for it to pass or to subside. If the migraine subsides, it gets less. It's less and less painful. I'm sorry if you do get migraines. I had at one point in my life, actually, again in Rome, I developed something called cluster headaches. Cluster headaches are one of these medical occurrences that doctors can't explain. A cluster headache means it comes in clusters, so a few at a time. Like for me, it was over 1 or 2 weeks, maybe 10 days I had these headaches. And they're intense like migraine, but they last for 4 hours and you literally go crazy. I went crazy at least. I remember walking through the center of Rome at 2 and 3 in the morning, feeling very bad. All right. A sprained ankle, an infection, we take antibiotics. Sprained ankle, an allergic reaction. So here's what I've done. I've decided to take a look at this. I have listed what I consider to be the 10 most common medical terms that you might use if you're on holiday. These terms might come in handy. I hope you don't, but so let's just go through them. Allergy. And what I've done is I have given sentences that are relatively common so that you can have a chance to use them later. I have a severe allergy to peanuts. Actually, I have a severe allergy to soya milk. It can kill me. So don't give me soya with my latte, please. Flu, short for influenza. I've got a flu shot today. Now in the US, we'd get flu shots in the late summer, along with a vaccine if you want it. So last year I was in the US, I got a flu shot. Do you get flu shots yearly, annually? We can say annually. This is a nice word for yearly. Let's just write it down. My annual flu shot. An antibiotic is what we looked at before. The doctor prescribed an antibiotic, or you can say antibiotic, antibiotic, something like that. It's a lot of ways to say this, I think, with the I. That first I is pretty flexible. I say antibiotic, I think. And you take them for infections. The vaccine, we all know about the vaccine. Some of us are for the vaccine, some of us are against it, and most of us just don't want to die. There we go. All right, the fever, they get their vaccines on schedule. Now look at schedule. We can also, if you're in Britain, you might say schedule, but in America, it's schedule. It means the same. A fever, if she's been, listen to this, running a fever, that's a collocation you need to know. She's been running a fever since yesterday. This is very common, so you might as well learn it. She's been running a fever since yesterday, so we're keeping her home from school. Now, you might need some painkillers after surgery, and the doctor might prescribe them. Prescribe painkillers. And if you have an ear infection, it's painful. So he has been feeling quite uncomfortable. What's the diagnosis? Now, doctors diagnose your condition. The diagnosis was a bit of a shock, but I'm ready to start treatment. And something that's chronic is something that lasts a long time. She suffers from chronic migraines. They are very bad. Chronic means it's sort of, you're going to actually see, because I've given you definitions for all of these, persists over a long period and might not have a cure. If it's chronic, there's probably no cure. So you can look, what I've done is I've given you the sentence, a symptom, and then I've defined them below. So you've got the very nice handy sheet here that I've done. All right, that's going to be probably the most important part for me. But let's continue. Pronunciation, again, very, very important. Some of these I might pronounce a little bit differently, slightly differently than the audio files will, because they're more purely British, but I'm sort of in the middle with American and British. So I think the flexibility to expose yourself to different accents is a good thing. And you're going to hear not just British and American, you're going to hear all sorts of accents in this course. And I think that's very helpful, not just among your colleagues and classmates, but also in the audio files. So you've got a lot here that you can practice. I would take this seriously because some of us are going to need to use these terms. As I mentioned, medical conditions can happen everywhere, including, unfortunately, including on holiday. So we have to be able to know how to communicate these critical words to the doctor. All right, listening I'm not doing the listening recording, someone else is, so that's not going to be my job. Now, we have a very interesting speaking session that you're going to do, or I can do. I might do a few of these in the live, but you're going to do them with your speaking partner. So when we meet for the live, you are going to pick a speaking partner, hopefully more than one, and have a few options during the week to practice these new words with the questions and the new, or in this case, old grammar that we're revising. Revising is a fancy word for review. In Britain, you revise. In America, you review or you study again. All right. Now, I'm not going to give you all the audio files because I don't think it's necessary. There are a lot here. I'll give you some of them. But I want to go to the grammar bank. And what I want to do is I'm highlighting the key ideas. And this is what I like about this book. They give you the essential grammar rules, and you simply have to go through them, read them line by line, and make sure you understand them. Now, here's what's great. Number one grammar rule, the grammar rule in number one corresponds with the two examples above. So let's just read them. Have you ever broken a bone? I've never seen him before. We talk about past experiences when you don't say when something happened, or often with ever or never. I have never broken a bone. That's not true. I've broken many bones, but we use it with ever and never. Great clue there. We use it also with just, with, yet, and already. Let's look at number two. I've just phoned for an ambulance, but it hasn't arrived yet. Yet. I've already told you. So these are clues that you're going to use present perfect simple, excuse me. Number three, with superlatives in first, second, third. That's the first time I've heard of it. It's the best book I've ever read. It's the second time in my life I've been to the Alps, for example. Finished actions which have present results when no time is specified. Remember, once we pick a time in the past, it immediately becomes simple past. So look at number four. My computer's crashed. My computer has crashed. We don't know when, and it still crashed. So we can say my computer's crashed. But if you mention when it crashed, we have to change it to simple past. My computer crashed yesterday. My computer crashed yesterday. My computer crashed Wednesday. Then it's simple past because it's an action that is definitely finished. It crashed and it's done crashing. It still crashed, but we mentioned Wednesday, so we have to keep it in simple past. Non-action verbs when it's still true. I've known Miriam. My sister has been ill. And then when we talk about how long, for, since, all day, all evening, they've seen each other twice this week. How many books have you read this week? How many books have you read this year? I don't read books front to back. Do you read books front to back or articles? I read articles sometimes front to back, but books I'm just dipping in and out. If you dip in and out of a book, you look at parts and you look at other parts, but you don't read it all the way through. I think that's true for most of us. I'm doing some writing now, and you just don't have time to read the whole book. You only read the bits or the parts that are most interesting and relevant for you. Now, if we look here, action, now we're looking at present perfect continuous. Action started in the past and it's still happening. How long have you been waiting to see the doctor? Well, I can tell you the answer for most of us: too long. No one likes to wait, but I think everyone waits in the doctor's office. And this is what I don't understand. How come it's okay that you can wait in the doctor or dentist office, but it's not okay anywhere else? We get angry if we have to wait, but in the doctor and dentist's office, we sort of just have to put up with it because it's our health. Maybe that's why. Our life is in someone else's hands. We have to be a little bit more patient. Number two, I haven't been sleeping well recently. It's been raining all day. all day or recently, we use the continuous, present perfect continuous. Again, present perfect continuous also with how long, all day, evening, etc. All right, so you can go ahead and read these. This is interesting. Go ahead and look at those. I've highlighted these for you to review. And guess what? Review again until you have them firmly in your mind, that you feel comfortable with the rules. And most importantly, that you can use them in the right moments with your speaking partner, with me, in your job, or on holiday. Take your pick. All right. Well, the last part, reading and speaking, we don't do the reading, but if you want to do some speaking, you can, and you can practice these. All of the answers are conveniently located below, and you can see here, the gray boxes are the exercises, and these sort of boxed in, darkened words are the audio transcripts. All right, everyone, happy studying. See you soon. Bye-bye.